Risk factors. Risk factors for cancer are various factors, conditions, or behaviors that can increase an individual's likelihood of developing cancer. It's important to note that having one or more risk factors doesn't necessarily mean a person will develop cancer, but it does raise their overall risk. Similarly, the absence of risk factors doesn't guarantee immunity from cancer. Here are some common risk factors associated with cancer. Age. The risk of developing cancer increases with age. As cells accumulate genetic mutations over time, the likelihood of uncontrolled cell growth, cancer, also increases. Tobacco use. Smoking and using tobacco products are linked to many types of cancer, including lung, mouth, throat, esophagus, kidney, bladder, and more. Family history. A family history of certain cancers, especially when they occur in close relatives, parents, siblings, can increase an individual's risk. Some cancers have a genetic component that can be inherited. Genetic mutations. Certain inherited gene mutations, such as BRCA1 and BRCA2 mutations, are associated with a higher risk of breast, ovarian, and other cancers. Exposure to carcinogens. Carcinogens are substances that can cause cancer. These can include chemicals in the workplace, environmental pollutants, and even some medications. Diet and nutrition. Poor dietary habits, high consumption of processed foods, red and processed meats, and low consumption of fruits and vegetables can contribute to an increased cancer risk. Obesity. Being overweight or obese is linked to an increased risk of several types of cancer, including breast, colon, kidney, and endometrial cancers. Physical inactivity. Lack of regular physical activity is associated with a higher risk of certain cancers, including colon, breast, and lung cancers. Sun exposure. Overexposure to ultraviolet UV radiation from the sun or tanning beds can increase the risk of skin cancer, including melanoma. Chronic infections. Infections such as human papillomavirus, HPV, hepatitis B and C, and Helicobacter pylori are linked to an increased risk of specific cancers. Hormone replacement therapy, HRT. Long-term use of hormone replacement therapy for menopause can slightly increase the risk of breast and ovarian cancers. Alcohol consumption. Heavy and regular alcohol consumption is associated with an increased risk of several types of cancer, including mouth, throat, liver, and breast cancers. It's important to remember that risk factors can interact in complex ways, and some cancers can develop without a clear identifiable cause. Additionally, many cancers are preventable or can be detected early through screening, which can improve outcomes. If you have concerns about your cancer risk, it's a good idea to talk to a healthcare provider who can provide personalized guidance based on your medical history and lifestyle.